All right, good morning, class. How's it going? How's it going? We're going to start chapter 8, which is the muscular system. So let's get started here. Let's see if I can put this to the side. Now, what's the point of chapter 8? Major muscles in the body. Of course, we're going to be able to identify all the muscles on the reading guide. So you don't have to memorize all 600, but you do have to memorize quite a few. Be able to identify the origin, insertion, and action of each muscle. And so I made a lab worksheet to help you with that, and that is due this week. So muscles are organs. Remember, a whole bunch of cells make up tissues, a whole bunch of tissues make up organs. So muscles are organs that generate force to cause all types of movement. Some examples of muscles in action are walking, breathing, pumping blood, and moving food in the digestive tract. So if you remember from the first week, we talked about skeletal muscle, which is voluntary control. So I can tell my biceps to contract. Smooth muscle, which is found in our digestive system, which is involuntary. I don't have to tell my stomach or I don't have to tell my intestines to digest. It just does it automatically. So it's involuntary. And then the cardiac muscle, which is your heart, again, that's involuntary. I don't have to tell it to beat. It just beats and it will adjust the heart rate depending on its demand. But in this lecture, we're just going to talk about voluntary skeletal muscles. So skeletal muscles are named according to any of these. So the size, the shape, the location, action, number of attachments, direction of its fibers. So let me give you some examples. You've probably heard of these muscles, and if you haven't, then what you don't want to do is you just want to memorize the name. You want to actually think about it and say, what is it actually saying? So let's talk about number one. Pectoralis major. So if you just look at the word major, you know that that's big, right? Pectoralis, you're like, okay, pecs. So big muscle in the pecs. There you go. Deltoid, name for the shape, it's like triangular. Extensor digitorum. Okay, so extension you learned last week or in the last module, extension is this way. Digitorum is these digits. So it's a muscle that's going to extend these digits. You see, so it actually makes sense. Biceps brachii. So you're thinking, I have no clue. Yes, you do. Because if you break it down, brachii, you know, means arm. Biceps means two. So two heads of the muscles in the arm. Okay? Tricep means three. So three heads of the muscle in the arm. So triceps. Now look at this one. Sternocleidomastoid. So if you took the time to learn the bones, this is why I told you that if you really learn the bones, then the muscles are a lot easier. So sterno meaning what? Sternum here. Cleido meaning clavicle, and mastoid process, if you remember, is behind the ear. So it's a muscle that goes from the sternum, clavicle, to the mastoid, sternocleidomastoid, and it helps you rotate. And both of them working together bend your neck. External oblique, you know the direction of the fibers, oblique, external meaning outside. So a muscle that's outside that runs in oblique direction. So now you're like, okay, I got this. It makes sense now. It's not as hard as it seems. Yeah. So origin, you want to know what the difference between origin and insertion means. Origin is the less movable end of the skeletal muscle. Insertion is the more movable. So give you an example, the origin of biceps is here, the insertion is here. So the insertion, when I contract, the insertion goes towards my origin. You see that? The insertion, which is the movable, more movable end, goes towards the more stable end, which is the origin. So biceps means two origins or heads. Both heads attached to portions of the scapula, the coracoid process, and tubercle groove. Insertion is the radial tuberosity of the radius. Muscles located on the anterior surface of the humerus. And action is flexion of the forearm. Remember, arm, forearm at the elbow. Okay, so if you look at this, here is the origin of the biceps. Here's the humerus, right? Here's the biceps brachii. You have another muscle called the brachialis, which is underneath it. And then you have tricep, which is posterior. Okay? And there's the radius and there's the ulna. So remember, all these bones are coming into play now. Remember the scapula, remember the humerus, remember the radius and the ulna. So this is why I stopped working out. I didn't want to get too big. Just kidding. This is actually quite impressive, but this doesn't happen overnight. You really have to work at this. But what you want to do is you want to say, okay, now here's the deltoid, pectoralis major, here's his lats, rectus abdominis, obliques, quads, gastroc, soleus underneath, vastus medialis, vastus lateralis, rectus femoris. So you want to go and see if you can actually recognize all these muscles on the human body. Now here's another good example here. I have a worksheet that actually will quiz you on this stuff. So frontalis, orbicularis oris here, trapezius, serratus anterior, external oblique, biceps, brachialis, brachioradialis. So you're thinking brachio means arm. Radius is, remember the radius, so it's a muscle that goes from the arm along the radius. Right, so again, these are named for a reason. Rectus abdominis, a straight muscle on the abdomen here. Okay, pectoralis major, we talked about this. Serratus, if you know what a serrated knife is, the one that kind of goes like this, and this is on the anterior side. So a serrated muscle, that's on the anterior side. You remember where the fibula is? Well, here's a long muscle along the fibula, fibularis longus. You know where the tibia is? Well, here's a muscle that's along the anterior side of the tibia, tibialis anterior. So again, like I was telling you, you want to understand the location or the meaning of the muscle, then it's a lot easier to name it. Even if you had to guess on it, you could make an educated guess on the muscle instead of just randomly pulling. Meaning, if I have a muscle on this side, the side that's flexor, you want to guess flexor versus extensor because you know the extensors are on that side. So like I said, make an educated guess if you don't know. Of course, I'd like you to know all the muscles, but if you had to guess, at least make an educated guess as to where the muscle is and what it's called. Here's the back. Temporalis, remember where the temporal bone is, so there's the temporalis. You know where the occipital bone is, so there's a muscle called occipitalis. See, it all comes together. A trapezius is trap-shaped. Okay, there's deltoid. Okay, infraspinatus. You remember the spine of the scapula below the spine of the scapula, so infraspinatus. There's a supraspinatus, which is above the spine of the scapula. External oblique, gluteus maximus. Okay. Big muscle of the glutes. There's gluteus medius. Adductor, you remember what abduction and adduction means. So you have a muscle that's big, magnus meaning big, that will adduct your muscles, right? So I mean, again, if you can break it down by the meaning, then the muscles are a lot easier than they seem. Okay? All right. So let's talk about, and we'll break it down. We'll start with muscles of the face first. So you have muscles of facial expression. Close my eyes, right? They're responsible for a variety of facial expressions possible in the human face, communicating anger, fear, pain, disgust, surprise, and happiness. Major muscles include the epicranius, orbicularis oculi, that's closing your eyes, orbicularis oris, so you pucker your lips, buccinator, suck in your cheeks, zygomaticus. If you have dimples, there's a defect of that zygomaticus that causes the dimples. So yeah, if you have dimples, you're defective. Probably not the way you want to do it, but hey, that's what it really means. And then plasma is this one right here. Okay. So if you look at this, there's the buccinator. Again, suck in your cheeks. Orbicularis oris, pucker your lips. Orbicularis oculi, close your eyes, wink your eyes. Zygomaticus, you have a major and a minor. Again, if this muscle splits into two, then it causes the dimples in your cheeks. So this muscle normally should be one. If it's normal, then you don't have dimples. If it splits into two, then you get dimples. Here's the masseter. Okay. Sternocleidomastoid we talked about, the trapezius in the back. Frontalis, remember the frontal bone, so there's a muscle on the frontalis. Remember the occipital bone, so there's occipitalis. Here's the buccinator. It can do this. It's also called a trumpeter muscle, so it does that, but it can also suck in. The real job of the buccinator is actually to keep your food in until you're ready to swallow. So it keeps, when you're chewing, the buccinator will bring the food in towards the middle and keep it like that. The plasma is right here. So if you look at this, this is normal, and then after they got Botox, it's right here. I'll explain Botox afterwards, after you learn how muscles contract. Remember, the whole theme is usually learn normal so you can figure out abnormal a lot easier, but you have to learn normal first. So I made a little table here, or here's a table. Epicranius, occipital bone. The insertion is skin around the eye and elevates the eyebrow. The orbicularis oculi, the origin is a maxilla and frontal bone. Insertion is skin around the eye and close the eye. So now you understand why knowing the parts of the bones are so important, because all these muscles originate or insert on various aspects of bone. So make flashcards, use the worksheet that I gave you to kind of learn this stuff, because I will quiz you on it, absolutely. Muscles of mastication. Chewing movements are derived from muscles attached to the mandible. Remember the mandible right here? Chewing muscles that elevate the mandible include the masseter and the temporalis. Temporalis is here. So as I move the jaw out and up, those are responsible for that. So the masseter, zygomatic arch, insertion on the posterior lateral surface of the mandible. So it elevates. So if I'm chewing, it will elevate and protract my jaw or mandible. Temporalis inserts on the coronoid process of the mandible. You remember that? So it elevates and retracts the jaw. Okay, so protraction, stick your mouth out, chin out, and then take your chin in. So temporalis helps give you a double chin, right? If you wanted to. Muscles that move the head. Paired muscles in the neck and upper neck cause flexion, extension, rotation of the head. You have the sternocleidomastoid, which is right here. You have the splenius capitis, semisplenius capitis, and the scalenes. I think on the worksheet that I gave you, I do have you label these. The scalenes, the semisplenius capitis, and the splenius capitis here, and there's the splenius capitis there. So the reason I highlighted these in red is because those are on your worksheet. Okay, so those are on that worksheet that you were doing. So you have the manubrium of the sternum and medial clavicle. Individually, they will laterally flex the head and rotate the head to the opposite side. So think about the right sternocleidomastoid. If I contract it, if I bring it this way, it actually helps me rotate to the left side. If I contract the left, it'll actually help me rotate to the right side. If they both contract together, then together they're going to pull the head forward and down. So that's a good thing to know for the quiz or for the exam, what the action of these muscles are. Splenius capitis individually rotates head to the same side. So remember how the sternocleidomastoid did the opposite side. Well, the splenius capitis is responsible for turning it to the same side. So let's say I wanted to turn my head to the right. Okay, so I'm going to use my right splenius capitis, but my left sternocleidomastoid. Right. So the semisplenius capitis individually rotates head to the opposite side. So the semispinous capitis and the sternocleidomastoid work together. Okay. Scalenes individually laterally flexes the head and neck to the same side. So if I'm rotating my head this way or this way, oh, that feels pretty good. Stretch that out. Stretch that out. So the right scalene will tilt my head to the right side. Laterally flex the head and to the neck, same side. Now, I don't know if you've heard of something called torticollis. So sometimes babies are born where their head is rotated to one side because in the mother's womb they were stuck like this for a few weeks. Happens sometimes with twins. They get crowded, so one is kind of pushed to this side and is kind of curled up in the corner. But if you look at this, this baby has a tight right sternocleidomastoid. So if the right side is tight, then it will cause the baby to rotate to the left, because remember, sternocleidomastoid does rotation to the opposite side. So I may ask something like that on a quiz or exam, because I think that's important for you to do. It puts things into perspective of why we're learning this stuff. So if we see it on a patient or if we see it on a little baby, it makes sense. So again, the right sternocleidomastoid, okay, will rotate me to the left. So if I have tightness in the right sternum, so if you ever see a patient and they're kind of rotated to one side, one of their sternocleidomastoid might be tight. You might need to work on that. Now with babies, if they get the proper treatment early and they get stretched and they do that, then they can actually, this can get a lot better without any complications. Okay. All right. So now let's go to the pectoral girdle, which is right around here. So muscles that move the pectoral girdle are associated with those that move the arm. So several chest and shoulder muscles that move the scapula. You've got the trap, okay, rhomboid major, levator scap here, serratus anterior, and pectoralis minor. So here's the trapezius, here's the deltoid, here's the latissimus. There's the rhomboid major, rhomboid minor. You've got the scalenes here. Here's the levator. A lot of times people will rub the levator. They're like, I've got a knot here. So Mr. Levator is responsible for a lot of that discomfort. You've got supraspinatus. Again, here's the spine. Something above it is called supra. Infra, below. There's teres minor. And then there's the rhomboid major. If you look at the front, you've got the sternocleidomastoid, you've got the scalenes, here's the deltoid, here's the pectoralis major, pectoralis minor. Okay, you've got internal intercostals, external intercostals. These are responsible for breathing. You've got pectoralis major. Here's the linea alba here. Here's your rectus abdominis. You've got your internal obliques. Remember we talked about external obliques, but then you've got internal obliques that the fibers run the other way. And you've got the transverse abdominis, which is here. So if you take your belly button and suck it towards your spine, that's your transverse abdominis. So you really have rectus abdominis, external obliques, internal obliques, and so you have 1, 2, 3, 4 layers of the abs. A lot of times people just associate abs with this, but you have obliques, you have internal, external, and then you have the transverse abdominis as well. Okay. Now, going back to the linea alba, which is right here, is a band of connective tissue. Unfortunately, during pregnancy, as the little baby is growing, and then the little baby becomes a big baby, you can actually get what we call a diastasis recti, where actually this connective tissue can split and cause a separation in the rectus abdominis. And this is what it can look like right along here. Now, unfortunately, this just doesn't go back and heal together, so you may permanently have this little disfiguration. The only real way to fix this would be surgery, but you don't really need to if you can work the core on the outside. So when we say core, we're talking about rectus abdominis, external oblique, internal oblique, transverse abdominis, paraspinals, everything that is around this area. So people say tighten your core. Well, you got to define what the core is first before you tell a patient to tighten it, because they don't even know what the core is. So what are they going to tighten? So you need to tell them or have them palpate and say, okay, this is the area. Well, like I said, this doesn't magically heal by itself. This is unfortunately permanent disfiguration, and the only true way of fixing this diastasis recti is to surgery, which most people don't need to do. They can live fine without it. Men that are extremely overweight can get this too. So if you see someone that has a stomach that protrudes out, they can get a diastasis recti as well. So they look like they're carrying 9-pound twins, but that's from all the food that they've been eating, right? So that can cause that diastasis recti as well. So there's the trapezius, occipital bone, origin, ligament, and nuque, spinous process of the 7th cervical and all thoracic. Rotates and retracts the scapula, rhomboid major, levator scap. Again, I have this chart for you to outline the origin, the insertion, and the action of the muscles. So it's a good idea to go back and look at this. I don't want to spend the lecture here just reading this because most of you will be bored. You can come back into the canvas and look at this, and this is already there for you. So you can make flashcards and review sheets based on this. But I did highlight the ones that are in red because those are the ones on your worksheet. Now look at Bruce Lee here. He's got some really good definition. Unfortunately, this is not working as far as the YouTube, but it was showing his 1-inch punch. But look at this, he's just ripped. Pectoralis major, you can see the serratus here, biceps, triceps. Look at his lats, looks like a cobra here. Okay, rectus abdominis, external obliques, deltoids, just lean and cut. Amazing. Now, if you get weakness in one of the muscles called the serratus anterior, you can get something called winging of the scapula, because the serratus anterior helps to keep your scapula against the thoracic cage. So this is something that can be corrected with some proper exercise and some neuromuscular retraining. Kids with Down syndrome can also have this. The difference between this is usually congenital, meaning they're born with this. And this was a patient that actually damaged it in football where he landed and damaged the long thoracic nerve. So you can see it's only on one side versus the other. So if it's both bilaterally, usually it's congenital or they're born this way, which is a little bit harder to fix. This is damage to the long thoracic nerve, and depending on the extent of the injury, this may or may not get better. Now remember, peripheral nerves, which we'll talk about later, they do have the capability of regenerating, but it's very slow. So in the meantime, we can do the strengthening and the stretching to make sure he doesn't get atrophy anywhere else. But yeah, this was a football player that landed right along here and damaged the long thoracic nerve. So the nerve that innervates the muscle was damaged. All right, so let's talk about muscles that move the arm. Actually, let's break this up into another session here.